One of the greatest challenges we have in hospice is explaining it to people. People know more about what it isn't than what it is. Yes, our patients are terminally ill. Yes, they have a life-limiting illness, but it's so much more about life, so much more about choice, so much more about living with whatever time we have left with the best quality of life possible.
This is the story of hospice, from voices of those who have been there.
My father was my hero. He died of congestive heart failure 3 years ago. That was a sad time, but at the same time, it's all the special memories that I have of him that makes me able to smile as I talk about him.
Dr. David Minikin, who was my husband's surgeon, recommended that we leave the nursing care facility and come home, which was a blessing for us, not only for me and for him, but you know, your friends are close by and your family is close by, and they feel, I believe, freer to visit in the comfort of your home.
Medicine's made huge strides, but we're far from curing all diseases, be it heart, be it AIDS, be it Alzheimer's or dementia, certainly cancer. And it's hard for people to let go of the traditional medical model of fix it and say, let's not just fix it, but let's just move on to the next stage of living well. For me, it was easy from the beginning when I helped my first person through the dying process. I realized I've done this person as good a service as if I'd cured them.
My patient was in a nursing home situation. She was comatose. So I would sit by her, I would touch her hand, I would read to her because her daughter had said, you know, she likes to hear this. So I took that as my little niche to fill and just sit there for the hour and a half that I had, and I read to her.
The hospice philosophy involves working together as a team. We have nurses, social workers, home health aides, chaplains, volunteers, and bereavement counselors for really a holistic approach to care.
I know that there was a social worker, I believe that person was called, who came once a week. There was a chaplain, Dr. Bowers, who came. The nurse name is forever imprinted in my mind. Her name was Joni. I know that because my father would always talk about Joni. But there were weekly visits. There were discussions about how my father should do certain things. Joni would take his blood pressure. More than anything, it was a lot of love and a lot of care, a lot of attention to Dad, which is why his life was prolonged.
And using Good Samaritan, then we were able to rely on the nurses to come give her care, the nurse aide to come and give her a bath, or attendant to give her a bath, and then the volunteer services, which were our lifeline. Because with 3 children, all under the age of 12, and in the small, teeny tiny 2-bedroom house out in Craig County, which is 40 miles away from basically anything, you know, there was just, they saved our life.
Laughing at a joke or hearing their stories. Hearing them tell stories that family members probably have heard and know by heart, but they're new to me and they're funny or they're exciting in some way, or it tells me more about them. And that's been good. And that's a two-way benefit because I enjoy hearing the stories and I think it benefits to be able to tell them. And perhaps for the volunteers as well as for the family members, you can find those wonderful things that make each day worth taking for its full value.
At Good Samaritan Hospice, we focus not only on the patient, but on the family as well, especially when there are children involved. We have individual counseling, grief programs, and other support services.
The hard part was watching her die and saying goodbye. But it made a big difference when hospice was there to give us hugs and stuff.
Well, it was sad, and we knew that it was almost there, and the hospice people they reassured us that she was okay, and they didn't let us be worried.
It was cool and nice because they always helped us out when we were feeling sad.
There was a level of assurance given to Mom that for whatever period of time Dad had left, it would be at the highest possible quality, that there was always someone who she could call if she noted something changing in Dad. She didn't have to go through the maze through the doctor's office. She could pick up the phone. She could call Joni. Joni established a relationship with my family, not just with Dad.
They had some pillows that we got to take home, and whatever we wanted to do with them, like beat them on the wall to express our feelings, well, the pillows sort of helped out.
Hospice doesn't just stop at helping people through a very difficult time. We go the extra mile to do whatever we can to make this as easy as possible.
You know, one thing that really, really touched my heart, on May 28th was Bernice's birthday, and she passed away on January 15th. And I was afraid of that day when it came because I knew it would be hard on my husband. And it was so touching when I got the mail that day, and there was a card there from Good Samaritan. And it wasn't a, thinking of you or just a cheery hello or anything like that. It was to remember you on this hardest of days, remembering, that you would be remembering your loved one on their birthday. And I thought, that was the neatest thing, because it made me feel so good, because we were kind of not touching it. We were trying to, shield each other's feelings from it and not bringing up that, this would have been her birthday. We should call her and wish her happy birthday, but she's not there. But Good Sam remembered and made it easier.
There is a brown stuffed animal. It's a Cocker Spaniel that Joni and the team gave my dad to look over him when they were not there. The dog still sits on the back of my father's recliner in the family room, and Dad loved that dog.
We got to write down a note or something that you wanted to do with them or you wanted to see them, and they put them on a piece of paper. We made a card, and we had Elvis balloons, and we sent them up. And when they get them in heaven, I bet they'd be really happy.
Some people think that hospice takes away choices, but it really doesn't. It empowers patients and families to make the choices that are right for them.
One of the early patients I remember who benefited from hospice, Tom, was a patient of mine. I have to admit, he was my patient who showed up in the emergency room ill-prepared to face his end, constipated. His problem was he just couldn't do one of his basic bodily functions. And he ended up in the emergency room on a weekend to get this accomplished. And after we got it accomplished in the emergency room, he said, "Nice knowing you, Doc." And it was one of those moments I could have, kind of a pivotal moment. I could have walked out and said, "Nice knowing you too," but I realized there was probably a little bit of a plum in there for me to pick. He meant something. And I came back in and, "What do you mean?" And we talked, and I realized, and he told me that he had planned to end his life that day. And his plan included a gun, rope. And I said, "Who's been helping you with your bowels? Who's been there doing your pain management? Where's the social worker? Where's the hospice nurse?" "What social worker? What hospice nurse? What are you talking about?" And at that point, we went into hospice. And we got his pain under control, and we got his bowels moving, and we got him, and he did so much during that next, 6 months. But it was a beautiful moment in which this man said, I could end it on a rafter in the garage, or I could end it the way he did. Fullness of life, not number of days.
Hospice to me means help and hope.
So hospice to me is hope. Hospice to me is a lessening of fear. And then hospice is, of course, this beautiful team of people taking care of other people.
It is encouragement when you feel down.
To me, hospice is security and loving care and support.
Hospice is about care, it's about love, it's about quality of life, it's about extended family.
It was a relief, and it was help. It was just a big relief.
Hospice to me is an opportunity, putting some of your gifts to a special use. Hospice is family.
To me, hospice is a calling. It's walking on sacred ground.
Hospice is about living really well in your last whatever. Let's talk about feeling as good as I can for the time I have left.